Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we look at problems in the healthcare system and take actions that can help make the system better for all of us. About 1 in 5 of us live in rural America. That's about 66 million people. Life there can be very different than in an urban environment. The T.H. Chan School of Public Health at Harvard and National Public Radio surveyed communities a few years ago as the pandemic was starting, a little bit before that. And I want to share some of their findings with you. And here's why. If we're going to be looking at solutions to problems in healthcare, it's best to make sure that we understand all the bases that have to be covered before anything gets implemented. Let's look at economics first. Researchers were interested in whether money was an issue with healthcare. So they asked people in rural America, if you had an unexpected $1,000 bill, could you afford it? Half of rural Americans said they would have a hard time paying a $1,000 expense right away. In addition, 4 in 10 of them said that their families had experienced problems affording medical bills, housing, or food in the past few years. 32% had a problem paying a medical or dental bill, and it was a major problem for 19% of them, almost 1 in 5. With respect to healthcare, the survey found that 26% of rural residents, that's like 1 out of 4, could not get healthcare. There were a variety of reasons. Almost half of them, 45%, said they couldn't afford it. 23% found it was too hard to get to an appointment. 22%, about 1 in 5, couldn't get an appointment that they could keep. And 19%, again about 1 in 5, couldn't find a doctor that would take their insurance. That's really scary. 87% of those people surveyed, so it's almost 90%, like 9 out of 10, had health insurance. Now, 87% is lower than the national average. The national average today is about 91.5%. So there are more people uninsured in rural America than on average in the rest of the country. Another part of the problem is having a place you can go to see a doctor. Maybe it's a hospital or a medical center. Doctors are sort of sparse in rural America because towns are very small. It's not uncommon to have towns of 2,000 or 3,000 people, and it's hard for a town with that few people to afford to pay one doctor. Anyway, hospitals have had an issue, especially in rural America, with closures. In the last 10 years or so, more than 100 rural hospitals have closed. I looked up some US government data and I found that from 1975 until 2015, almost 1,000 hospitals have closed in the United States. We've written about this in the newsletter Healthcare Advocacy. There's a real issue with commercial funds buying up hospitals and then sort of bleeding them dry into non-existence. That's not always the case, but losing a hospital means it's just hard to find a place to go to the doctor. How about telehealth? What about the internet? Well, good news, most rural Americans say they use the internet. 85%. 15% never do. Now, among those that use the internet, almost 70% say they use it to get health information. And 24% of them, again, about 1 out of 4, have used telehealth to get diagnoses for chronic treatments, about a quarter of them, emergency treatments, about 16%, some for infectious diagnosis, and almost half of them get prescriptions through telehealth. That's good. Okay, what are we going to do? Problem summary. Let's look at what we've learned. Income is a problem in rural areas, as evidenced by so many people who can't afford an unexpected expense. 87% have insurance, but the survey found that a quarter of rural residents needed health care and couldn't get it. Cost, distance to the provider, no appointments that they could meet, and unaccepted insurance were the top reasons. Many rural hospitals have closed in the last 10 years, so reaching facilities that could provide care can often take hours. Actually, I have a friend here in Washington who needed to get to a doctor for a minor surgery. I think it took 2.5 hours, a ferry, and buses. This is really hard. Well, internet access can help provide telehealth, and that can provide some medical care. But again, 15% don't have any, and you've got to get people to use it. And you know, telehealth isn't free. It's like a doctor visit, and there is a cost. So let's try to imagine a different situation. If everyone had insurance with no copays and no deductibles, that would cover the expense portion of the problem. We could all go to a doctor if there were one there. If there was a way to build up the infrastructure in medical deserts and in rural America to get doctors and nurses into healthcare facilities in these kinds of locations, that would help. And if everyone who needed internet access could get it, well, that would help. So let's think. Universal healthcare means that everyone has insurance. So that's a start, and we already know from the Congressional Budget Office report of 2020 that it costs less to have everybody insured through a public insurance program, paying private providers, than we're paying right now. That's good news. Building up the infrastructure requires regional management. You can't have people in a faraway place try to figure out what you need locally. So you need regional management guided by local medical professionals who know what skills and facilities are needed in their neighborhood, together with a budget to bring in the providers and to build up and then maintain the facilities. I want to refer you to Section 403, Regional Administration of House Resolution 3421, the Improved Medicare for All Act. You'll discover how regional authorities are able to build up that infrastructure in rural communities. I want to refer you also to Section 601, the National Health Budgets of House Resolution 3421. And there you'll discover how regional authorities will have the budget to build up and maintain needed infrastructure and to get people in place to care for rural America. I want you to look at Section 201, Comprehensive Benefits of H.R. 3421. There you'll see what's covered. And I got to tell you, it's pretty complete. And we don't have the problem that insurance won't pay. It's got pretty much everything covered. Lastly, I want to refer you to Section 611, Global Budgets of H.R. 3421. That section makes sure that hospitals and networks have what they need to cover their staff and their infrastructure to make sure that they can provide care for their patients. Well, there are other bills in Congress to expand internet access, but I want you to remember something. 85% of rural America has access. Not everybody uses it for telehealth. H.R. 3421 has a section 201, paragraph 18, and it says, any service described in the comprehensive benefits section that is furnished via telehealth to the extent practical is covered. So that'll bring a lot of people into the tent. So what's the action we can take? Well, we need to teach our congressional representatives and our senators that H.R. 3421, the Improved Medicare for All Act, makes good sense to cover all of us. It builds up the healthcare infrastructure in rural areas to make sure that the 66 million rural Americans have the good healthcare they deserve, and in fact that all of us deserve. Okay, in the description section, I will have a link to our Healthcare Advocacy Newsletter. It has all the references to what I've discussed today, and it will have contact information for a link that you can use to contact your representatives and your senators. Or if you want to go the easy route, you can text on your cell phone to 50409, sign, S-I-G-N, PGFENY, to send this email. I'll read it to you as fast as I can. Ready? I'm your constituent, and I learned that rural healthcare is a serious problem. More rural Americans lack health insurance. They have to travel far to get to a doctor, and it's hard to pay for, even when they have insurance that's accepted. We can fix all of it with the Improved Medicare for All Act, HR 3421. Let me show you. And then I just go through the entire description I just gave you up above with each section number. So that's the action for today. I'll also include that in its full text in the description section. Thank you for watching. Like, share, subscribe. I'll also put a link into Healthcare Advocacy, our daily newsletter. And if you like, you can subscribe there or look through any of the hundreds of previous articles we have. Have a good day. Bye-bye.